Hormones are natural substances produced in the body. They help to relay messages between cells and organs and affect many bodily functions. Everyone has what are considered male and female sex hormones. Types of female sex hormones. The two main female sex hormones are estrogen and progesterone. Although testosterone is considered a male hormone, females also produce and need a small amount of this, too. Estrogen. Estrogen is the major female hormone. The lion's share comes from the ovaries, but small amounts are produced in the adrenal glands and fat cells. During pregnancy, the placenta also makes estrogen. Estrogen plays a big role in reproductive and sexual development, including puberty, menstruation, pregnancy, menopause. Estrogen also affects the brain, cardiovascular system, hair, musculoskeletal system, skin, urinary tract. Estrogen also affects the brain, cardiovascular system, hair, musculoskeletal system, skin, urinary tract. Estrogen levels can be determined by a blood test, while it can vary from person to person. Progesterone. The ovaries produce the female sex hormone progesterone after ovulation. During pregnancy, the placenta also produces some. The role of progesterone is to prepare the lining of the uterus for a fertilized egg, support pregnancy, suppress estrogen production after ovulation. Testosterone. Small amounts of testosterone come from the adrenal glands and ovaries. This hormone plays a role in several body functions, including sexual desire, regulation of the menstrual cycle, bone and muscle strength. Female sex hormones are integral to many body functions. But your hormonal needs change a great deal as you leave childhood and enter puberty. They also change dramatically if you become pregnant, give birth, or breastfeed. And they continue to change as you near menopause. These changes are natural and expected. Puberty. Everyone is different, but most females enter puberty between the ages of 8 and 13. And it all happens because of hormones. The luteinizing hormone, LH, and follicle-stimulating hormone, FSH, are produced in the pituitary gland. Production increases at puberty, which in turn stimulates the sex hormones, especially estrogen. This increase in female sex hormones results in the development of breasts, the growth of pubic and armpit hair, an overall growth spurt, an increase in body fat, especially in the hips and thighs, the maturation of the ovaries, uterus, and vagina, the start of the menstrual cycle. Menstruation. The first menstrual period, menarche, happens about 2 to 3 years after the breasts begin to develop. Again, it's different for everybody, but most females get their first period between the ages of 10 and 16. Follicular phase. Every month, the uterus thickens in preparation for a fertilized egg. When there's no fertilized egg, estrogen and progesterone levels stay low. This prompts your uterus to shed its lining. The day you start to bleed is day 1 of your cycle, or the follicular phase. The pituitary gland starts to produce a little more FSH. This spurs growth of follicles in your ovaries. Within each follicle is an egg. As sex hormone levels drop, only a single, dominant follicle will continue to grow. As this follicle produces more estrogen, the other follicles break down. Higher levels of estrogen stimulate an LH surge. This phase lasts about 2 weeks. Ovulating phase. Next comes the ovulating phase. LH causes the follicle to rupture and release the egg. This phase lasts about 16 to 32 hours. Fertilization can only occur for about 12 hours after the egg has left the ovary. Luteal phase. The luteal phase starts after ovulation. The ruptured follicle closes and the production of progesterone increases. This gets the uterus ready to receive a fertilized egg. If that doesn't happen, estrogen and progesterone decrease again, and the cycle starts all over. The entire menstrual cycle lasts around 25 to 36 days. Bleeding lasts between 3 and 7 days. But this, too, varies quite a bit. Your cycle may be quite irregular for the first few years. It can also vary at different times of your life or when you use hormonal contraceptives.